Chuan Tiao, commonly translated as ligusticum powder regulated with green tea, is a classical traditional Chinese medicine formula in the category dispel wind and relieve headache. Its core action is to dispel external wind and relieve headache along multiple channels. The pattern framework is wind invasion causing headache. This mini-lecture focuses on the formula logic, recognizable pattern features, and practical drug-herb interaction screening. It is an educational overview, not an instruction to self-prescribe. Start with the pattern rather than the disease label. The traditional target pattern is wind invasion causing headache. Typical clues include headache, nasal congestion, aversion to wind, neck tension, thin coat, floating pulse. These findings are not all required, and the same biomedical diagnosis can present with different Chinese medicine patterns. Conversely, these traditional signs can arise from multiple biomedical conditions. That is why pattern differentiation and conventional red flag screening should occur together. Key herbs commonly associated with this formula include Chuan, Jingjai, Bohi, Qianghuo, Baizhai, Fangfeng, Zaizin, Gankao, green tea. In classical formula analysis, some herbs address the principal mechanism, others support the chief action, and others harmonize or direct the prescription. The exact composition can vary by lineage, manufacturer, granule concentration, and modification. For interaction analysis, the actual ingredient label and dose are more important than relying only on the traditional formula name. The first interaction focuses bleeding and antithrombotic medicines. Several blood-moving or blood-nourishing herbs in this formula may have antiplatelet or anticoagulant activity in experimental or clinical literature. The practical concern is additive bleeding with warfarin, direct oral anticoagulants, aspirin, clopidogrel, or perioperative use. Evidence varies by herb and product, so the safest approach is medication reconciliation, bleeding history review, and coordinated monitoring rather than assuming either safety or danger. In practice, ask what prescription drugs, over-the-counter products, supplements, alcohol, caffeine, and other herbal formulas the person uses. A multi-herb product can create several overlapping mechanisms at once, so medication reconciliation is a core safety step. The second interaction focuses Gankao and electrolyte-sensitive drugs. Licorice-containing formulas deserve attention during sustained or high-dose use. Glycyrrhizin can produce a mineralocorticoid-like effect in susceptible people, with sodium retention, blood pressure elevation, and potassium loss. That can matter with loop or thiazide diuretics, digoxin, corticosteroids, antiarrhythmics, and existing hypertension. The risk is dose, duration, and patient dependent. The quality of evidence for herb-drug interactions ranges from pharmacology and case reports to controlled human data, and that evidence is uneven. Therefore, distinguish a proven contraindication from a plausible additive effect, and use monitoring where the uncertainty is clinically meaningful. Safety summary. Thunderclap headache, focal neurologic deficit, fever with neck stiffness, or new severe headache requires urgent medical evaluation. Also verify species identity, processing method, contamination testing, and manufacturer quality. Stop and seek appropriate care for severe or rapidly worsening symptoms, allergic reactions, fainting, chest pain, major bleeding, neurologic deficits, or other red flags. Pregnancy, breastfeeding, significant kidney or liver disease, and polypharmacy warrant a lower threshold for professional review. A useful clinical checklist has 5 steps. 1. Confirm the traditional pattern. 2. Identify the exact product and full ingredient list. 3. Reconcile prescriptions, over-the-counter drugs, supplements, and other herbs. 4. Identify measurable endpoints, such as blood pressure, glucose, inner, electrolytes, symptoms, or malfunction when relevant. 5. Reassess after starting, stopping, or changing the formula rather than assuming the response will be stable. In summary, Chuan Tiao is best understood as a pattern-based prescription, whose action is to dispel external wind and relieve headache along multiple channels. The key safety principle is targeted interaction screening plus objective monitoring when risk is plausible. Standard references for further study include Chinese herbal medicine formulas and strategies by Bensky and colleagues, Chinese medical herbology and pharmacology by Chen, and current drug interaction and pharmacology references.